This week on Healthy Living, we're talking about caesarean sections. When are they needed and how to keep patients safe? And an expert discusses the challenges of C-section in Africa and what can be done. Plus, some waste speakers at Nairobi's Dandora dump risk severe health issues. We'll have these stories and more in this edition of Healthy Living. Hello, thank you for joining us for another edition of Healthy Living. I'm Lina Ahmoudou. When a woman gives birth, she can push the baby out of her womb or she can undergo a caesarean section. A caesarean section, also known as C-section or caesarean birth, is a surgical delivery of a baby through an incision or cut made in the mother's abdomen and uterus. Medical providers perform a C-section when a natural delivery may put the life of the mother, the baby, or both of their lives at risk. Cases often include difficult labor, high blood pressure, and problems with the umbilical cord. Caesarean sections, however, are performed sometimes for no medical reasons, often upon a mother's request. According to the World Health Organization, caesarean section use continues to rise globally and now accounts for more than 1 in 5 of all childbirth. Experts say access to safe caesarean section procedures in underserved communities such as those in Africa is an effective way to reduce maternal mortality. However, many women die due to a lack of access to the life-saving surgery, bleeding, infection, or errors in the procedure. In Senegal, a pregnant woman lost her life recently along with her unborn baby while undergoing a C-section. The incident sparked the ongoing debate regarding the need for better access to safe caesarean sections in Africa. Dr. Hadiza Abdullahi Usman is a professor of Obstetrics and Gynecology at the University of Maiduguri Teaching Hospital. She discusses the challenges of C-sections and what can be done.
Caesarean section is very, very safe now, and it's very common. Almost every doctor is trained, but nowadays not even doctors in some countries are even getting that or encouraging and training lower cadre staff, not just at the level of the doctors, to be able to conduct caesarean section in rural setting. Most people will go, especially in the rural setting, they will go for antenatal care. But when it comes to delivery, they will stay at home and be attended to by untrained traditional birth attendant. Even the trained traditional birth attendant, there's a limit to which she can do. Her knowledge is not that exposed. When the complication will set in, she will not know. So that is why we kept on saying that the safest, the most important means or ways of preventing maternal mortality is the presence of a skilled birth attendant during delivery. So it's becoming very, very safe. But still the issue, maybe lack of awareness is still making, because if I should cite the typical example of the challenges we face, even in this teaching hospital now, when you say you want to carry out caesarean section in a woman, you see the relatives dragging their feet. They will tell you that all my generation, all my relatives are delivering vaginally. Why should my wife deliver by caesarean section? We've seen mothers, parents taking away their daughters that they will never have over their dead body. They will never have caesarean section. But caesarean section is very, very safe now. There are women that can even come on their own and have elective caesarean section on maternal request because they feel that they don't want to go through the pain of labor. But the most important is when there is need for that caesarean section, especially if you're going for antenatal care and a problem can be identified. Either your baby is not lying the way it should lie, or your pelvis is contracted, or the placenta may even come and cover the vagina where the baby is supposed to pass through and come out. And of course, if I have something blocking where I'm supposed to pass through, I have to dislodge that thing that is blocking it. And when you dislodge a placenta, that is one of the causes of bleeding that can make a woman to die. So you can see that we always have an indication, not that a woman will just be sectioned for the sake of sectioning. is either in the interest of saving the life of the baby or saving the life of the woman. Caesarean section is quite safe, and it has been shown to reduce maternal mortality and equally infant mortality. Assessing is the availability of the healthcare providers, the hospital setting that can conduct caesarean section, which most of the times we do have, except in the rural setting where they have to be referred early if they realize that there are certain problems that this woman cannot actually make it and have a safe delivery. They do refer them early. But most of the times, some of these things you still have to pay. So it's still boiling down to the cost implications, since most of the times it's still out of pocket expensive. And if you're not, that is why we always preach on bad preparedness. God has given you 9 months, so you should be prepared for the worst outcome. And one of the worst outcomes is the possibility of having caesarean section. So the money should be made available. Blood should equally be, who is going to donate blood should equally be sourced for right from beginning. And with the slightest observation that there's a problem, that individual or that pregnant woman should be taken to where she can have safe delivery. So for us to really reduce the number of women that are dying, awareness, education, giving the girl child the requisite education, financial empowerment, support from the family, especially the husband, will go a long way. But most importantly, providing the needed health works, providing the midwives that can stay in the rural setting, and then going to the hospital, and then probably making the services free to some extent.
People sifting through waste at Nairobi's Dandora Dam are risking severe health issues, including cancer and infertility. The United Nations Environment Programme warns that the dump site poses serious health threats to those working and living nearby.
Acrid smoke billows from the mountain of waste at the Dandora rubbish dump in Nairobi. International humanitarian organization Concern Worldwide reports that about 10,000 women, children and a few men scavenge through the piles of rubbish daily. They sift through the waste, most with bare hands, for their livelihood.
Tunatafuta hizi chupa zinaitwa kwinja, matingili box.
We usually look for plastic bottles, carton box, gunny bags, bones and pig food. Yet we do this without protective gloves and gumboots, so we sometimes get cuts from glass.
The health risks go beyond scrapes and cuts. The United Nations Environment Programme, UNEP, warns that air pollution created by the Dandora landfill is a wide range of health risks for both workers and the community nearby. They include skin disorders, cancers, respiratory abnormalities, and blood disorders.
Lead and mercury are heavy metals. And most of the time, the women who are working at the dump site, they are actually inhaling at the same time ingesting these particular heavy metals. It's not only affecting the reproductive health, but it's also affecting the women. And most women are actually ending up with cancer. Remember, mercury is one of the major metals associated with cancer. Lead the same.
Mother of 6, Winfred Wanjira, spends her working days filling her sack with recyclable plastics to make enough money to feed her children. Her health is at risk, and she is aware.
Sometimes you might unexpectedly lose your pregnancy, but when you change your environment, you can have a successful pregnancy. However, when you try to change your environment, you may lack work opportunities and your children become hungry. You have no other option but to come back.
So if a woman gets cancer and she's not aware that she has cancer, most of the time, the first thing that is affected is her menstrual cycle. This could be one of the first signs, heavy bleeding. When she has the heavy bleeding and that is irregular, it could be actually an early warning sign that this particular woman is actually having cancer, especially cancer of the reproductive parts.
The United Nations Environment Assembly has initiated this year in Nairobi negotiations for a global agreement to end plastic pollution.
In the resolution that was passed by the UNEA to end plastic pollution, one of the key benefits that we've been able to see from that is waste pickers being recognized. So the Intergovernmental Negotiating Committee are required to learn from the experiences of waste speakers because they have so much information just by working in the dump sites. And they're also recognized as people who play an integral part in the formal waste management system. So with this, we are hoping that also countries and Kenya to be among those who are championing for the rights of waste speakers and formalized and included in all policy and waste management processes.
Kenya's 2021 Sustainable Waste Management Bill outlines objectives for county governments to improve waste management infrastructure, which observers say is a step in the right direction.
China's drug regulator has approved an inhalable vaccine against COVID-19 for emergency use as a booster. The company, CanSino, says the needle-free vaccine, which can be stored and administered more easily than intramuscular jabs, will be given through a nebulizer. Scientists conducted a clinical trial on adult patients who had already received 2 doses of the Chinese injectable CoronaVac vaccine. After the first injection in the arm, a booster vaccine by inhalation on day 28 provided robust antibody responses, according to the researchers. They say the nasal vaccines could block infection more effectively than those currently used by injection and are easier to store. No independent study has yet evaluated its effectiveness. Scientists from several countries, including Cuba, Canada, and the United States, are also conducting trials on inhalable vaccines against COVID-19. After doctors diagnosed Paula Estrada with breast cancer in 2009, the then 41-year-old Argentine decided she would not only beat the disease, but would do so without losing her long blonde hair to the ravages of chemotherapy. Take a look.
At her home in Buenos Aires, Paula Estrada, a graphic designer by profession, set about creating a makeshift helmet out of ice packs that, instead of being used for sports injuries, would help keep her scalp cold and ward off hair loss.
My oncologist said, "But you are having chemotherapy." But I was happy. When I finished treatment, I get emotional about the spot. I told him, I can't keep the helmet for myself. I want everyone to have the chance to not lose their hair, just as I had.
The cold from the helmet constricted blood vessels and helped keep the chemotherapy drugs from reaching Estrada's hair follicles. Over a decade later, versions of Estrada's helmet have helped some 60,000 cancer patients in Argentina, as well as Chile, Mexico, Spain, and the United States. The helmet has increasingly been used in Argentina's main hospitals following the Food and Drug Administration's approval in 2017.
The efficacy of the helmet is based on the cold temperature that produces vasoconstriction. Vasoconstriction lowers the amount of drug that gets to the hair follicle, and that helps prevent hair loss.
The helmet must be used from the first chemo session and needs to be kept at -4 degrees Fahrenheit or -20 degrees Celsius and changed every 30 minutes. Maria Angeles Fernandez, a 48-year-old liver cancer patient, says it's worth it and it makes you fight the disease in a different way.
Hay que ponerlos 2 días antes en el congelador.
I think the helmet was the key to keeping my mood up. I don't feel anything while wearing it. I get out of treatment, take the helmet off, and live my life like any other person.
Caesarean, a 64-year-old retiree with breast cancer, says she agrees.
You have to put the helmet in the freezer 2 days in advance. I know it takes some logistics, but it's worth it because it makes you fight the illness differently. You, your children, and your surroundings see yourself differently. So I continue using the helmet.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on Twitter at Linor Mudu. Until next time, stay well and strive to make every day a healthy day.